This
Dr.
conference will now be
Omar
recorded.
Yes. Yeah. Can you please, as we speak now, use the chat box? Okay. In the chat box, I have said I will ask the question and you can answer in order to recap, in order to build up on our session. I have mentioned every station is how many minutes? Every station in plab 2, every OSCE, 8 minutes. I have mentioned that in these 8 minutes, I have 3 domains to cover. 3 domains in every station to cover. What are the 3 domains? Domain number 1, history and what? No, I did not just say history. No, just data gathering. No, it is data gathering, examination, initial investigation, or investigation leading to. Okay. And the second domain, what is the second domain? The second domain, provisional diagnosis and treatment. What is the third domain? The third domain is IPS. Okay. I have mentioned that from the 8 minutes, how much should we spend in history and examination and initial investigation? How much? I said 4 minutes. 4 minutes out of 8 minutes. And the other 4 minutes in giving a provisional diagnosis and management. Why, Dr. Mo, 4 minutes provisional and management? Because that's where we will show our what? That's where in data in management and the provisional diagnosis, that's where we will show the IPS, the communication skills. Perfect. 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 So I have mentioned that when we do the provisional diagnosis and management, I have mentioned in provisional diagnosis, it is all about what? In provisional diagnosis, it's all about baby language. It's all about breaking down things. It's not about from the history you're giving me, I think that you have appendicitis. No. There is a finger-like structure in our bowel. This finger-like structure doesn't have any function. Usually it's infected. When it's infected, usually we do surgery in order to remove it. So the provisional diagnosis. Okay, and when I spoke about management, I said in management, it should be what? The conversation should be what in management? In management, the conversation should be two-way conversation. Two-way conversation, two-way conversation, two-way conversation. Okay. Did all of you watch A1 and A2 videos, communication skills and the structure? Did all of you watched A1, communication skills, and A2 structure? Okay. The A1 communication skills is very important. One of the doctors here, yeah, so the A1 communication skills, Allah Akbar Azam. The A1 communication skills, it is for you. So A1 and A2, it is the first 2 videos you watch. Start with. Allah Akbar Azam. The A1 communication skills, guys, don't worry. The A1 communication skills, Allah Akbar Azam, is covering all plab 2. Is covering all plab 2. What do you mean, Dr. Moss, covering all plab 2? So the communication skills, I gathered all of them in one video, but it will be spread out in the rest of the lectures. Do you understand me? So when you watch them, they sound too much, but it's the communication skills of all plab 2. How to speak to the patient, active listening, how to ask about sexual history. So it's plab 2 communication skills, not just okay, one video. No, it's covering all communication skills. Okay, so if you watch the structure in A2, so A1 is communication skills, A2 is structure. Again, these structures will cover most of plab 2. Okay, now there is something very important, and it is the most important lecture in plab 2. What is this lecture? the most important lecture in plab 2. How to manage my time. Dr. Mo, you have mentioned that history should take 4 minutes. Yes, I did mention history should take 4 minutes out of 8 minutes. But Dr. Mo, the history that we take is too long. Do you agree with me? Do you agree with me that the history sometimes is too long? Okay. Dr. Mo, we cannot finish the station on time. Okay. You should not exceed 4 minutes in history. If you are unlucky, you should spend 5 minutes out of 8 minutes. If you are unlucky, 5 out of 8 minutes. Dr. Mo, more than this. All right. How to do the history in 4 minutes. Okay. صلى على النبي. صلى على النبي. All the doctors in front of me should they should have watched the structure. All the doctors in front of me should have watched the A2 lecture, the structure. And guys, when I tell you watch such and such in the session, if you have not watched them, you're not going to be able to follow. So my point is, every week I will give you some topics. If you want to finish plab 2 in 8 weeks, we're going to finish it together. If you drop, if you miss, it's not my problem. So my target is 8 weeks to finish plab 2. Okay. So now I want to take history in 4 minutes. Okay. So I will give you brand new structure. Brand new structure. Brand new structure to take history. It is new. Nobody yet knows about this structure. It is called relevant history taking structure. Again, it is called what? It is called what? Relevant history taking structure. Or in brackets, it is called 4 minutes history taking structures. It's not anywhere. It is new structure. I have made it to save you time and to tell you what is relevant history. So please, plab 2 rules. Do not share your material with people. It's already shared enough. Okay, so please keep these things to yourself. Okay, let's start together writing the brand new, okay, iPhone 14 Pro Max. Okay, iPhone 14 Pro Max. Okay, brand new history. Let's write the history together, and this history will be only for the doctors who are already aware of the lecture, history taking lecture, which is the structure A2. The doctors who missed watching A2 lecture, they must watch it to understand what I'm going to say today. Okay, and I've already mentioned before, you must watch this to watch today's lecture. Okay, first of all, how many structures do we have? How many structures do we have? How many structures do we have in A2? In A2, in the lecture A2, which is the structure, we have three structures. Okay, we have medicine structure, we have counseling structure, we have test result structure. So we have 3 types of structures, 3 types of stations I can follow in plab 2. We have a medicine structure in plab 2. What do you mean, Dr. Mo, medicine structure? It's a station where, hi, how can I help you chest pain? Hi, how can I help you headache? Hi, how can I help you difficulty in swallowing? That's called medicine. Medicine. It's not diagnosed. In brackets, the medicine station, in brackets, not diagnosed. All right. What is the second station? What is the second type of structure? Counseling structure. Counseling structure, it is a station where it is diagnosed, but the patient has some concerns. That's why it's called counseling. It is talking. That's called counseling. Dr. Mo, what do you mean? Clarify. 55 years old, Andrew Thompson is diabetic. Yes. Presented to the GP clinic with a concern. So is he diagnosed or not? Yes, he's diagnosed. He's diabetic. 55 years old, Alicia Keys. She's diagnosed with epilepsy. She's coming with a concern. Is she diagnosed or not? Yes, she's diagnosed. So basically, counseling is a station where it's diagnosed already. But the patient is coming with a concern. A concern. That's the counseling. And in this station, the structure already, I have explained it in A2 video. I have explained in A2 videos the structure for counseling. It's already relevant. I don't need to tell you how to take relevant history here, because if you watch A2 videos, I told you the meaning of relevant in counseling station. And test result. Did you watch the A2 video? Did you watch the A2 video? Yes, we did. In test result station, do you take history? Do you take differentials? No, I don't. No, I do not take differential. Why? Because again, the test result station, they tell you 25 years old, Ashwarya Roy, presented to the GOM clinic, the genitourinary clinic, because she had the charge. Swab was taken and shows chlamydia or shows gonorrhea. Talk to her, address her concern. So she's coming for the test result, for the swab result that showed gonorrhea. So is the diagnosis there or not? Is there a diagnosis in the test result station or not? Yes, there is diagnosis. Do you need to take differentials? Do you need to take differential? No, we take differentials only to reach our diagnosis. But this lady, she came already, and the doctor took differential and he asked for swab, and the swab shows gonorrhea or chlamydia. So she's coming for you for two things: to explain the result, write down in the test result stations, because in the exam you will have 2-3 stations test result. Stations, you'll have 2-3 test result. So she's coming for you two things: to tell her the result, to explain the result, yes, and for you to ask about the cause. She's having chlamydia or gonorrhea, yes. When you tell her it's a chlamydia or gonorrhea or PID, the first question she will ask you, doctor, why did I have it? Doctor, why did I have this? So you need to have an answer. So in this kind of stations, only 3 things you will do. Number 1, explain the result. Number 2, ask about the causes, the risk factors for the condition. Dr. Mo, do I know the condition? Do I know the condition before I start the station? In the test result, yes. You will know, they will tell you. CT scan showed the aneurysm, the triple abdominal aortic aneurysm, X-ray showed fracture, swab result showed the chlamydia. So you know. So you only need to know the cause. You ask about the risk factors and then you manage. Guys, are you lost? Are you lost? No, we're not lost. So I have told you that we have 3 types of stations. 3 types: medicine, counseling, test result. I have explained the 3 structures in my course in A2 session, A2 station. By the way, if you have a structure, wallahi, you will never be stuck. You will never be stuck. Don't teach me how to eat the fish, but teach me what? Don't teach me how to eat the fish. Don't tell me this is a station, copy it, get in. Copy it. No, teach me how to deal with the station. Now, the only structure from the 3 structures that we need to know about the relevant structure, the relevant history is what? Which structure? Now, test result we know from A2. Counseling we know that there is no history. It just, asking about the causes, the risk factors. The medicine structure is the structure where we struggle with history, and is the structure where I have modified the structure to make it relevant for you, in order for you to know if I have a station chest pain, if I have a station joint pain, if I have a station headache, what is relevant to history? in these medicine stations. Okay, can we write down the medicine relevant history taking structure? Can we write it down? Write down number 1, P1. What is P1? What is P1? No, Dr. Basant. It's not P1, P2, P3 anymore. It's not P1, P2, P3 anymore. Okay? It is slightly different. So P1 is the presenting complaint. Presenting complaint. So explore the presenting complaint. All right. Dr. Mo, whenever we start with our patient, we will ask the presenting complaint and then we will explore it. When I said explore it, I use two things. Either explore it by Socrates if it's pain, or Odipara if it's not pain. That's how you explore any complaint. All right. P1, explore. And when you explore any presenting complaint, what is Socrates? What is Odipara? It is in the course. It is in A2 course. It is in A2. These sessions are for practice. It's not to explain the content of the videos. So the videos there. So if I have a relevant history, I will start with P1 presenting complaint. I will explore the presenting complaint. Dr. Mo, should we explore it quickly or in details? Should we explore presenting complaint quickly or in details? It's the only thing in my structure that I will explore in details, presenting complaint. Why? I will tell you why later. I will tell you why when we are at a station. So presenting complaint, explore. Okay, how to explore the complaint? Number 1, by asking open question. By asking open question. How can I help you? Doctor, I have headache. Tell me more. Can you please tell me more about it? Recently in the exam, they say, like what, doctor? Tell you more like what? And people say, well, Dr. Mo, can we just avoid the open question because the patient nowadays, they say like what? No, you can't. You can. ABC in medicine, open question. ABC in medicine is asking open question. So P1, presenting complaint, start with the open question. Can you please tell me more about it? Then if the patient said like what, start asking. When we explore the presenting complaint, we either use what? Socrates, which is site, onset, character, radiation, alleviating factor, and exacerbating factor, and timing, and anything else, and severity. Odipara is the same, but for any other symptoms. Odipara is the same, but for any other symptoms. What is Odipara? Onset, duration, yeah, the same. Onset, duration, alleviating factor, okay, exacerbating factor, same. So Odipara similar to Socrates, but Odipara, there is no radiation on Odipara. You don't ask the patient, is it radiating anywhere? So if you ask the patient, what do you mean, Dr. Mo? So in the pain, you ask, is it radiating? So radiation. But on Odipara, similar to the Socrates, but there is no radiation. If the patient is saying, I'm coughing, you don't say to him, is this cough radiating anywhere else? If the patient said, I can't see, you don't say to him, is it radiating anywhere else? So Socrates only for pain. And the difference between Socrates and Odipara is mainly there is no radiation in Odipara. So Odipara for any other symptom. Are you lost? I'm trying to give some details. To recap with you. I could just say boom, 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 because you already watched A2. But I'm trying to recap. So for anybody who's watched the video, to a bit of recap as we go. Okay. So what is the first thing that I will start in my new structure, history taking structure, relevant structure? What is the first thing I will do? Explore P1. Okay. Number two, right away, associated symptoms. That's the second word or the second line after presenting complaint. What is the difference between associated symptoms and the complaint? عادي. Associated main complaint is headache. Anything else? Yes, doctor. Blurred vision. Yes, doctor. Facial weakness. So it's associated symptoms. So after presenting complaint, after exploring the presenting complaint, I will boom, ask my patient. Anything else apart from the headache? Then the patient will give you the associated symptoms. He will tell you, yes, doctor, cough. Yes, doctor, blurred vision. So after asking the presenting complaint, you should ask the patient, apart from the headache, anything else? Now you are looking for what? By asking anything else, you are looking for what? You are looking for the associated symptoms. No. Associated symptoms. I have not done yet any differentials. I have only asked about the presenting complaint and the associated symptoms to the presenting complaint. A patient is coming with abdominal pain. Anything else? Yes, doctor. Vomiting. Yes, doctor. Diarrhea. Yes, doctor. You know, so the associated symptoms. And then ask about the associated symptoms. What do you mean, Dr. Mo? How can I help you? Doctor, I have fever. So fever is considered as what? I have fever. He's coming with fever, presenting complaint. Fever is coming as what? P1, presenting complaint. This is the main complaint. Then you will explore it. When did it start? Did you measure it? Then anything else apart from the fever. Then he will say, yes, doctor, I have rash. So rash became as what? Associated symptoms. It's something with the fever. Or I have vomiting. I am vomiting. Vomiting became as associated symptoms. I have seen Dr. Manal, and Dr. Manal said the associated symptoms very quickly. The associated symptoms very quickly. What do you mean by quickly? What do you mean by quickly? So if I have fever and vomiting, do you want to know the color of the vomit or not? Do you want to know, have they started together, fever and vomiting, or not? Do you want to know when did the vomiting start or not? Do you want to know, is there any blood in the vomit or not? Do you want to know how often do I vomit or not? So the associated symptoms, you need to ask a bit in details because you need to get something. Anyway, so far I have said P1, Dr. Zakiya Sanjari. Your camera is on. You have a very nice curtain. Very nice curtains. Anyway, so P1 is presenting complaint. Then associated symptoms. After the associated symptoms, what should I do? What should I do after the associated symptoms? Concern. Main concern. Okay, main concern. Dr. Mo, what do you mean by main concern? Can you please put a star on top of main concern? Can you please put a star on top of the main concern? Main concern, star. Why? Because that's where you will lose marks. What do you mean, Dr. Mo? What do you mean, Dr. Mo? That's where I will lose marks. When you manage, I'm not going to talk about management today, but when you manage the patient later on, you need to manage his condition and his concern. So if you don't ask about the concern, you will lose in management. Can you please give us example? Give us an example, please. Okay. Give us an example. How can I help you? Doctor, I have chest pain. Chest pain. Okay. You explored the chest pain using Socrates. You explored the chest pain using Socrates. And you asked the patient, are you in pain now? The patient said no. And now you can see that it's not acute. From the presenting complaint, You can see it's not acute. It's not MI. It's not something acute now. Then you asked about associated symptoms. It's not MI. There is no radiation. There is nothing, no shortness of breath. You understand me, guys, or not? Then you ask the patient after the associated symptoms, what's your main worry? What's your main concern? The patient said, my main concern is heart attack. So what is the patient's main concern? MI. The patient's main concern is MI. So in management, you know what's not MI. After taking differential, after the concern, I will come to differentials now. Don't worry. But at the end of the history, you realized it's not what? At the end of the history, you realized it's not MI. So in management, you started managing the patient. It was stable angina. It was a stable angina. So you started managing the patient, but you did not tell him that your case is not MI, and you did not tell him why it's not MI. Again, you did not tell him it's not MI, and you did not tell him why it's not MI, because you need to tell him why you're not suspecting MI. But you managed stable angina. But you managed stable angina. Are you gonna get full mark in management? No, you're not gonna get full mark in management, because management is about managing the patient to concern. So this patient needs to know, his concern to be addressed. Okay. So please, main concern will come after associated symptoms. What is after the main concern? What is after the main concern?
DD.
Okay. After the main concern, write down, write down, write down, because now we're gonna start to change a bit. Maximum of 4 relevant differentials. Write down. Maximum of 4 relevant differentials. Okay. How many differentials? 4. Okay. I cannot really talk much about differentials here, because when you start, inshallah, from day 1, you will see that with every symptom, my course is symptomatic. So with every symptom, I have given like 15 differentials. Do you need to ask all of them? Do you need to ask all of them? No, I don't need to ask all of them. I will tell you now, but when we apply it on a station, the only way you will understand what I'm saying after we apply history relevant on a station. When we apply the relevant history on a station in medicine, you will know. Anyway, but just for now, write maximum 4 differential. Write down 4 differentials. And in these 4 differentials, write down one of them is most serious. One of them, guys, they are selling tomato, 3 kilo for 10 pounds. Something I cannot, I cannot avoid, yeah? 3 kilos for 10 pounds. So one of these differentials, one of these 4 differential, write down, it will be the most serious. Write down, and that will all come later. The most serious. So how many differentials do you need? How many differentials do you need? 4 differentials. But one of them will be what? One of them will be the most serious. Okay, I will tell you, I will explain to you, don't worry. That will all come in a station, but just this is the modified structure. Okay. One of the doctors asked, what about the risk factors? The risk factors, which are the causes of the condition, you will only ask them after differential, because you cannot ask about the risk factor of the condition if you don't know the condition. Do you understand me? So the risk factor, it is the causes for the problem. You cannot ask about the causes of the problem until you know the problem. So the risk factors will come right after differentials. So right after differentials, risk factors. Risk factors. Write down risk factors. Dr. Mo, what do you mean? A patient is coming with headache. I explored the P1. The headache is chronic. It's there for like 4 months. It comes and goes and everything. Now I established it's quite tension headache. For example, ask about associated symptoms, nothing. Main concern, nothing. Then I started asking differentials. In these differentials, one of them will be most serious. So what is the most serious cause of headache? What is the most serious cause of headache?
Meningitis.
For example, meningitis. So I will need to ask about fever and space occupying lesion, for example. So I can ask about any neck stiffness, okay? Things like this. So of the differential, you need to exclude most serious. Anyway, then by asking the differentials, it's not meningitis, it's not space occupying lesion. So right away, you need to ask about the risk factors. The risk factors for headache or the risk factors for the tension headache you are thinking about. The risk factor for your tension. So you cannot ask a risk factor unless you ask differentials, because by differentials, you excluded and you are thinking of a condition. Are you lost or not? Okay. I have asked my four differentials, then I went for risk factor. By the way, there is something important I want to tell you on the differential part. When you ask about differential, there is something very important I want to ask.
Floors?
If a patient is coming with headache, okay, I explored the presenting complaint and the headache is there for 6 months. All right. And the headache comes and goes. Okay. And the headache is band-like headache. All right. And the headache, that's all in the complaint. When you ask the presenting complaint clearly, you will know what's happening. It is chronic, 6 months, nothing else, no associated symptoms. Okay. Are you going to be thinking of meningitis or space occupying lesion? I will ask them just to make sure it's not serious, which is valid. I need to ask. But my point is, when you start watching my videos, when you start watching headache, by the way, today is a general structure, yeah? It is a general session. So when you start using the course, when you start watching the headache, I give you in the headache lecture, it's not now, it's later on, it's recorded already. I have given you about 10 differentials. How many? 10. I've given you 10 differentials. Out of these 10 differentials, write down as an example, write down. In the headache, I have given you head injury as a cause. Write down head injury as a cause of headache. I have given you meningitis as a cause of headache. I have given you space occupying lesion as a cause of headache. I have given, by the way, I have put this, by the way, my lectures, inshallah, you will enjoy it. You will love it. You will love it. You will love how to take history differentials in a very good way. I have given you as a differential cluster headache. I've given you as a differential glaucoma. I have given you as a differential tension headache, migraine headache, GCA, okay, tension, migraine, GCA, okay, giant cell arthritis, and I've given you as well as hypertension as a cause and vision problem as a cause, hypertension and vision, and sinusitis. So how many differentials? How many differentials? How many differentials? $11. Okay. صلى على النبي. I have 11 differential. All right, you have 11 differential. And why did you give us? I need to give you example. I'm giving you example because as we go in the course, you will apply what I have mentioned today in the course. Are you lost? We will apply today's lecture on the whole course. Okay. You given us 11 differential. Okay. 11 differential. Okay. These 11 differentials, out of them, how many differential can cause chronic headache with no fever? There is no fever here. I've asked my patient associated symptoms. No, just the headache, chronic headache. How many of these can cause chronic headache?
4.
4, 5, around 4, 5. Okay, basically, let's put it that way, half of them. Say half. Okay, so half of them can glaucoma cause chronic headache. The acute kind of glaucoma doesn't. Can subarachnoid hemorrhage cause chronic headache? No. Can meningitis cause chronic headache? No. Okay, many of them no. But the chronic headache will be tension, migraine, tension, migraine, cluster, okay, and the hypertension and the vision problem. Are you lost? Are you lost? Space occupying lesion, yes. You're not lost. So out of this, I got 6 differential because it's a chronic. طيب صلى على النبي. By asking that, so guys, do you know how I'm thinking now? Guys, do you know how I think? Do you know how I think? Do you know how I think or not? We need to think. Okay? Okay. So thinking is like our Egyptian accent. In Egypt, we don't say I think, we say I think. So I don't think so. So, okay, that's our Egyptian accent. So out of this differential, we have 6. 6 differential chronic. All right, 6 differential. Dr. Mo, but you asked us for differential. You told, by the way, it's not Quran, yeah? This is not Bible or Quran. The 4 differential, I said 4 differential, it might be 5 or 6, it's fine. It's fine, you know, like it's fine. But not 12. Not 12. Okay. So out of this differential, Dr. Mo, we have 6 for chronic. Okay. Can one of the doctors, you are all smart, tell me, can I quote these 6 differential to 4 after the presenting complaint?
Oh my God.
After asking the presenting complaint, can I quote them to when I reach differential? Can I only ask about 4, 5, 3? Yes, I can. Why? Because by asking Socrates, by asking the radiation, the patient is not gonna say one-sided headache. In presenting complaint, in Socrates, the patient will say, yes, doctor. So what is the type of pain? Doctor, it's all around my head. That's the site. It's a band-like. It comes and goes, doctor. It's there for about 6 months, doctor. That's the site of it. It doesn't go anywhere else, doctor. It's like a band. So is it migraine? Even though migraine is one of the chronic headaches. So my point, what are you trying to say, Dr. Mo? I'm trying to say, after exploring the complaint well, that even will decrease the differential. So when you reach your differentials, you will basically get to know that, yes, number 1, by asking the presenting complaint, it's a chronic headache. So now I will be asking mainly about chronic headache. Number 2, while I'm asking about the presenting complaint, there is no radiation. It is just band-like. So I will even knock the migraine. When I asking about presenting complaint, the patient is saying, for example, after associated symptoms, no fever, no nothing. So now I will exclude things as I go. By the time I reach differential, I will only have 4 differential. Are you lost? So yes, Dr. Sarah. Yes, Dr. Sarah. I will give you example. Don't worry. But my point is, that's what people do. How can I help you? Doctor, I have headache. They explore headache. After exploring a headache, because we have in the course 12 differential, then did you injure your head? And then they look at the ceiling to think, huh? They are thinking enough. No, doctor, I didn't. Any blood division? No, doctor, I don't. Any fever? No, doctor, I don't. Then they look at the ceiling and they say, okay. Any pain while chewing? No, doctor, I don't. Any pain while combing? No, doctor, I don't have. Any pain while straightening your hair? When you are straightening your hair? No, doctor, I have. Any pain while you are playing in your hair? No, doctor, I don't. Guys, even I've given you now a small joke to give you another message. Even when you are asking about one of the differentials, okay, I have explored the presenting complaint. Socrates. From Socrates, it's chronic, it's tension, it's band, it's around the head. From Socrates, I realized it's tension. Okay. I moved to associated symptoms, nothing, no associated symptoms. I moved to the concern, no concern, no concern. Then when I come to differential, is it meningitis? Is it meningitis? It's no. However, Dr. Dania Khan, Doctor, she's very, Dr. Ray Blade, Dr. Rania Khan, you know, they are very interactive, very good. However, Dr. Ray, when I reached my differentials, I said to myself, I will ask about space occupying region, and I will also ask about meningitis. I need to ask about both of them. And you know what? No. As a most serious, for example, you want to ask in order to be safe, doctor, as a most serious, because I said out of your differentials, you must include what? Out of your differentials, you must include what? What? Most serious. So, Dr. Mo, I want to ask about meningitis and I want to ask about space occupying lesion. All right, it's fine. You can ask. Totally fine. You can. It's most serious and don't ask. That's what people do. That's what we do. Meningitis. What are the symptoms of meningitis? Fever, rash, neck stiffness, photophobia, vomiting. Okay. خلاص. So one of the things that you do and you lose marks because of the time management. Now my differential is meningitis. So you start asking, any fever? The patient say no. Then you look at the wall, at the floor, at the ceiling, and you say, any rash? The patient say no. Wall, floor, ceiling, any vomiting? The patient say no. Wall, floor, ceiling, any neck stiffness? The patient said no. Then you look, are you shy away from light? The patient say no. Guys, you need one major common known symptom. Can you have meningitis without fever? Can you have meningitis without fever? No, we can't. But you can have meningitis without rash. Yes, so no, we can't. So you can ask any fever, any rash, and that's it. You don't need to ask. My point, when you have a differential, you don't need to ask all the questions. Are you following me? Guys, in plab 2, time is not the key. Time is money. Dr. Manal Ashraf, yeah, she was on the same page. Time is money. Booking accommodation again, booking exam again, 900 pounds. Yeah, time is money. Stress. Time is money. So we need every single second. So far, differentials according to the complaint. So as per the complaint, presenting complaint, I will go for differential. If it's a chronic complaint, I will go for chronic differential. If it's acute complaint, acute differential. Whenever you're asking about one of the conditions, always ask about what? Always ask about, whenever ask about the condition that is not, that you know that you know, you ask about a condition that you know you are just trying to be safe. Ask about 1 or 2 symptoms, not all of them. Not all of them. Not all of them. And then after differential, we said risk factor. Risk factor for what? Risk factor for the condition you are talking about. Risk factor for the condition you are talking about. Risk factors. All right. Okay. After risk factor, what should I do? What's up? What's up? What's up? What's up? What's up? After risk factor, what should I do? After risk factor, after risk factor, what should I do? No. Flows. Flows is there. We have to have flows somehow. Flows. Okay? Okay. Flows, fever, lethargic, loss of appetite, weight loss. Okay. However, 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 the red flags, weight loss, loss of appetite, night sweat. I want you in brackets, in brackets, in brackets. Fever is a must anyway. Fever is one of the red flags that you can ask any age. Are you following me? Fever is one of the red flags that you will ask at any age. However, the other red flags for cancer, loss of appetite, weight loss, night sweat, lethargic. I want you in brackets to write down elderly, elderly, elderly. What do you mean? Flows is red flag, but mostly we think of cancer in an old age. Yes, Dr. Mo, cancer can affect 20 years old. I know that. I know that. I know cancer can affect 20 years old, 25, 20. I know that. But I'm saying that these red flags, in order to save your time, one of them is mandatory. One of them is mandatory. Fever. Fever is red flag anywhere. Fever, infection, red flag for infection. Flows is red flags, guys. Red flags is the meaning of red flags in plab. 2 things that you must not miss. Red flags. So flows is red flags. Guys, are you lost? I hope you are not lost. No, the doctors that will be lost are the doctors who are not following the lectures. A1, A2. I'm talking about now A1, A2, how to cut the history short, what is relevant, what is not relevant, how many symptoms, how many questions, and you know. So the red flags flows, one of them is mandatory, fever. And the rest are for old age. صلوا على النبي. If a patient is coming with tension headache, a patient 30 years old is coming with tension headache, because elderly means over 45, 50, 49, 52, you know, elderly, not 25, 29, 31, 32, 33, you know. When we say elderly, it's extreme age, but cancer over 45, you start thinking of, you know. So a patient is coming with headache. You explored Socrates tension, in Socrates chronic, in Socrates in the presenting complaint band like. Associated symptom, no fever, nothing, nothing, no associated symptoms. Concern, concern. Differential, no, nothing is serious. It's just chronic and everything. Would you really ask about loss of appetite and weight loss and night sweat? Would you really ask about you know, lethargic? Would you? No, you wouldn't. Guys, no, you would. If a patient is coming, guys, I'm talking about relevant history. 25 years old presented with headache. 25 years old presented with headache. How can I help you, doctor? I have headache. Tell me more about it. Doctor, it's all around my head. It's for about 6 months. I have this headache before I go to my college, before I go to my work. It's annoying, doctor. Radiation, no. Anywhere, no. Anything that makes it worse, going to college, doctor. Going to college makes it worse. Then I go to associated symptoms, nothing. Then I go to concern. He's not really concerned about anything. It's just the headache, doctor. No associated symptoms. Differential, no fever, no rash, nothing, no early morning vomiting or anything. And, then I came to risk factors. It's the stress. Risk factors, stress, to ask about stressful conditions. Then when I came to flows, is lethargic, loss of appetite, weight loss, might sweat important for you or not? That's my question now. I broke it down to tell you what I mean. No, it's not. It's not. Guys, I'm trying to save your time. I'm giving you structure to save your time. I'm trying to make you understand, because Dr. Mo, why should I ask them? I want to ask them really. Okay, if you ask 4 or 5 questions, they will take 40 seconds. Another 4 or 5 questions somewhere irrelevant, 40 seconds. Another 4 or 5. You have only 4 or 5 minutes for the history. You have 8 minutes for the station. Do you understand what I'm saying, guys? Do you understand what I'm saying? Especially if the patient is really annoying. Any night sweats? What do you mean, doctor? What do you mean night sweats? يخرب بيتك, يخرب بيتك. We need to go quickly. We need to go quickly. I have time. Any lumps or bumps in your? What do you mean, doctor? Lumps or bumps? Yes, doctor. I have a lump in my back, doctor. And then you follow him. Oh, lump. Oh, it's lipoma, doctor. It was diagnosed lipoma, doctor. So my point is relevant. Every 3, 4 irrelevant questions will make a difference in your. Will make a difference in your what? Will make a difference in your what? Every 4, 5 irrelevant question will make a difference in your life, not in your time, in your life, not in your performance, in your life. We need to pass lab 2. We need to pass quick. We need to come to UK quick. We need to earn the sterling. We need to earn the sterling quick. We need to bring our family dependent visas quick. We need to settle quick. We need the British passport quick. You understand? We need everything quick, inshallah. So time is money, and irrelevant questions will cost you, Anyway. So now that's the close. After that, I will go quickly. Just to give me 1 moment, guys, to check who's outside. 1 second. حقيقة ابو حميد ربنا يكرمك. So back again. So after that, I will go quickly. After that, I will go quickly. So what is the rest of my structure? And after I give you the rest of the structure, I will right away give you a station, and we only need to take history in 4 minutes. Deal. I will give you a station where we will take 4-minute history. Okay. What are they laughing about? Are they laughing at me? I see you, bro. Oh, okay. Just facts. All right. Guys, psychosocial is a must if it's chronic, of course. Psychosocial, how is it affecting your life? Yes, of course. It is a must if it's chronic. Where should I put it? After P1, okay. After differentials, okay. Anywhere. It is a must. It is a must. Psychosocial. Of course, it is a must. Of course. Okay. In fact, psychosocial, only you will ask psychosocial, nobody else. Try to practice with people who have not heard about our course. Try to practice with nobody knows about psychosocial. Boom, 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 robotic. After risk factor, quickly write down. P2, write down. P2. Okay. Plus or minus. So P2 is mandatory or not? P2 is mandatory. P2 is mandatory. P2 is mandatory. After that, so all the above mandatory. So P2, when you ask about P2, I will say to the patient, are you generally fit and well? انزلي go downstairs and open the door. افتحي الست تحت افتحي لها جديد. So P2, I will ask my patient, do you have any medical conditions? Okay, guys, and I want you to change, you know, so P2 is medical condition and P2 is past history of presenting complaint. So have you had this headache before? So P2 is two questions. P2 is two questions. P2 is two questions. Have you had this problem before? And any medical condition. P2 is two questions. Have you had this headache before? Have you had this vomiting before? Okay, and any medical condition. If the patient said no, no, I'm totally fit and well. I am totally. If the patient said no, I am totally fit and well, please, there is no need to ask about like hypertension, like diabetes, and that's it. So, do you have any medical conditions at all? Do you have any health issues at all? No, doctor, I'm totally fit and well. Done. Move on. You don't need to say like this, like that, like this, like that. Clear, guys? Clear. If the patient said no, move on. Any health issues? No, move on. Are you in any medical? Do you have any medical conditions? No, move on. Any health issues that you visit your GP regularly for? No, move on. It's all the same meanings, yeah. They all have the same meanings. I'm just trying to, you know, rephrase them. Okay. We all pass the OET, and sometimes we need to pick phrases, you know. Okay, so P2, P2, or I can make it, because that's improvising the structure now, I can make it P1, associated symptoms, concern for disease, risk factor, and the AP. Make them AP, guys. Make them AP. AP. What is AP? App. Just but not with double P. AP. A allergy, P, P2. So make it AP, guys. So we put allergy in between. Allergy is mandatory. So AP. So Dr. Ray, can you write down the main point on the chat box? So far, our mandatory history. Can you write it down? Can you write it down? Just in the chat box, 5 lines. Yes. No, not all of it. Guys, P1, presenting complaint. Associated symptoms, concern, for disease, risk factor, and finally, what is the last thing I said? AP.
Flows.
What is AP? What is AP? A, allergy. P is P2. AP2. Yes, AP2. Allergy and P2. That's it. My history now is finished. So what do you mean by finished? So what's coming is plus or minus. Write down. Plus or minus. Write down. Plus or minus. Plus or minus. Plus or minus here. Guys, P2 is past history. But we added allergy to it. So I said allergy and past history. Doctor, all what we've mentioned, we said, Dr. Khadija, P2 is not associated symptoms, Dr. Khadija. P2 is past history of presenting complaint and the past medical condition. That's P2. Associated symptoms is the symptom that is coming, the patient coming with, in addition to his main complaint. Okay, so perfect. Dr. Nafiza, she put them there. Okay, perfect. Now everything is coming plus or minus. Write down, guys. Everything is coming plus or minus. What do you mean plus or minus? I will tell you now what do I mean plus or minus. Plus or minus, write down. Desa and lactose. Plus or minus, desa and maftose. Plus or minus, desa and maftosa. Okay. What is DESA? What is maftosa? What is DESA? What is maftosa? And why are they plus or minus? Are they mandatory? Are they mandatory? Are they? No, no, no. They are not mandatory. Give us an example. I will give you an example. I will give you an example. So plus or minus DESA and maftosa. DESA and maftosa. Guys, what is DESA? What is DESA? What is DESA and maftosa? DESA, D for diet, E for exercise, S for smoking, stress, sexual history. So what does S stand for? Smoking, stress, sexual history. And A for alcohol. Are you lost? So S for smoking, stress, sexual history. Okay? So جداد انزل تحت. انزل تحت. So S for smoking, stress, sexual history. So what do you mean, Dr. Mo, plus or minus? How can I help you? Guys, I'm just discussing DESA. Leave maftosa now. Leave maftosa now. I'm just talking about DESA now. Are you lost? Are you lost? Just I'm talking about DESA. Leave maftosa. Maftosa is common. First of all, is DESA plus or minus or mandatory? Is DESA plus or minus or mandatory? Dr. Lobna, yes. You can add, guys, you can add to DESA IV drug abuse, but sexual history already asked. You can add IV drug abuse. Yes, DESA and IV drug abuse all in the same line. Anyway, is DESA mandatory or optional? Optional. Give us an example. Give us an example. How can I help you? Doctor, I have discharge from the front passage. Guys, by the way, in order to, because that's a point that will come in like day 5 in the course or day 6 in the course. Just stop for seconds, and for a second, I will tell you something. When we explore the presenting complaint, I said we use something, either or. Guys, I said we use either or. What did we use when we explore the presenting complaint? What do we use to explore them? Socrates or Odibara. Okay, add track as well. So Socrates for pain, track for discharge, Odibara for anything else. Again, when we explore the presenting complaint, we use Socrates for pain. Some doctors are saying, maybe they are thinking, doctor, we are lost. Doctor, we are. Don't worry. All what we are discussing is coming in the course. You don't need to worry. This is just an introduction, and it will be all clear. Socrates for pain. If a patient is coming with pain, we ask Socrates. If a patient is coming with discharge, we ask a track. What do you mean by discharge? Discharge front passage, discharge from the nose, discharge from the eyes, discharge from the ears, discharge from anywhere. We use track. Track is timing, the time of the discharge. R is relation. Is it related to anything? Is this discharge related to anything? A for amount of discharge, C for color and the consistency and the blood. Color, consistency, which means is it like fluidy, is it, and color, what is the color of it, and is it containing the blood or not? That's C. Anyway, let's move on. That's just a small thing I added here and there. Don't worry, let's go back again. We are talking about DESA and the IV drug abuse. We said DESA, diet, exercise. S for smoking, sexual history, stress. A for alcohol, IV drug abuse. I said it is not mandatory, it is optional. It is optional, it's not mandatory, but I'm giving you example now of how to pick. How can I help you, Dr. Ray? No, Dr. Ray, no. You cannot say Dr. Ray. How can I help you, Ashwarya Roy? Ashwarya Roy, I have discharge from my front passage. That's her complaint. I explore the discharge. After exploring the discharge, presenting complaint, what do we use to explore the discharge? What do we use? I use the track, timing, relation, amount, color. Then associated symptoms are asked, then concerns, and I ask differentials and risk factors, and I'm going towards STI. It's going towards sexually transmitted infection. Then I'm reaching DESA. Is diet important? Is diet related to discharge? Is diet related to discharge? Because when you ask a question, you need to know the importance. What will be adding? What will be this question adding to me? So is diet important for you? Okay, what about exercise? Is exercise important for you? Exercise. Is it important for you to ask exercise? What is the relationship between exercise and discharge? Okay. For example, what does S stand for? S. Smoking, stress, sex. S. Okay. Is stress really important for you? In that case, discharge, front passage? No. Is really smoking important for you? Really? Is really smoking important for you? In this case? Yes, it is important. Yes, it is important. I was just trying to ask that way for people to say, no, it's not. Because the way I'm asking, is it really important? Yes, it is important. Yes, because you are, maybe it's cervical cancer, for example. So yes, it is important. But sexual history, is it really important? In that case, discharge, of course, it is the most important point in the whole of the history. The whole of the history. Okay. Can someone who's really awake and alert tell me, can sexual history come a bit earlier? If you will bring sexual history a bit earlier in the case of discharge, where will you put it? Where will you put it? Where? Risk factors. Because the patient is coming with discharge from the front passage. You are looking for STI. The risk factors, when you reach risk factors, it's sex. Are you following? Yes. Okay. So IV drug abuse important. Okay, because any sexual history case. By the way, in the course videos A1, we spoken about sexual history, how to ask. Did you see it or not? The A1 communication skill course, communication skills in A1 day. Okay, and when you start the gynecology, that will all be revised again. That will be all revised again. Don't worry. So my point is, it's all built up from now. All built up. Anything you take, it will be built up. Sometimes you can take something here, and later on you find it somewhere else. Okay, so plus or minus DESA and MAFTOSA. Do you understand now DESA? What do I mean by plus or minus? If a patient is coming with fever and pain in his ears and discharge from his ear, is diet important? Diet. Exercise important? Exercise. Is stress important? Stress. STI important? No. Smoking important? Yes, you can ask smoking here. Any infection, discharge, yes. Okay. So use from DESA what is relevant for you. Now, what is after DESA? What is after DESA? MAFTOSA. Guys, and again. Dr. Mo, if I ask a question like diet in a station like discharge, will I lose marks? No, you're not gonna lose marks. But it just will be irrelevant. It will be time consuming, you know. But you're not gonna lose marks. Are you following, guys? You're not gonna lose marks. Don't worry. Don't worry. You will not lose marks. You will not lose marks. So you're not gonna lose marks. So if you ask irrelevant questions, will I lose marks? If I ask irrelevant questions, I will lose money. Okay? I will lose money. So if you ask irrelevant questions, you will lose money. Why? Because you're gonna lose time. Why? Because time is money. You understand? So make sure you ask less irrelevant question, but don't worry. That wouldn't worry you as long as you understand the concepts. Don't worry with the practice, it will be decreased. And at any time you ask a relevant question, don't worry, it will not deduct any marks. Nothing will happen, but we need to decrease the amount of irrelevant questions, okay? Now, so plus or minus DESA and MAFTOSA. So is MAFTOSA mandatory or must? Sorry, is it mandatory or optional? Is it a must to ask or optional? Optional. What is MAFTOSA? What is MAFTOSA? M for medication, which I think you should ask. Medication, of course, you should ask. Medication, yes, ask medication, yeah. A for allergy, already asked. A for allergy, already asked. We already asked about it. F family history, yes, you will need to ask. Contact, is contact important in all the stations? Contact, is contact important in all the stations? Contact history. So you can add medication. So you can add medical condition, medication allergy. Where? So again, you can add medical condition, medication allergy, medical condition, medication allergy, and they come together. Put them together. Medical condition, medication allergy, medical condition, medication allergy. Map. Okay. Map. Dr. who? Dr. Lobna. So now Dr. Lobna is improvising now a new structure. Map, yes. Medical condition, medication allergy. Okay, so the rest of MAFTOSA, like contact history, psychosocial, its own occupation, these things depend on the case. What do you mean it depends on the case? If a patient is coming with heart attack, chest pain, severe central crushing, do you want to ask contact history or travel history? T for travel and contact. MAFTOSA, T travel and contact. MAFTOSA, M for medication, A for allergy, F for family history, T for travel and contact, O for occupation, S for psychosocial. So do you want to ask about contact? Contact, guys, is like skin infection, STI. Contact, cough, contact. It's contact, coming from contact. So do you want to ask about contact? Have you been in contact with anybody who has the same symptoms? The doctor was asking about contact. Is it clear now? Is it clear now? The doctor is asking about contact. Is it clear?
Yes, it is.
So
Thank you.
contact. So is it important to ask about occupation in MI? What do you do for living? The patient is dying. Yeah, he's dying. Severe central crushing, chest pain, left shoulder, left jaw. You know, what do you do for living? May I ask what you do for living? Social. How is this chest pain affecting your life? How is this chest pain affecting your daily activity in a chest pain MI station? Can you? Okay. Can you even ask DESA for a patient who's having acute MI? No. No. You do not ask DESA for a patient who's having MI. Angina, of course. Angina is not emergency. The patient is okay. The patient does not have a chest pain. He's complaining of a chest pain when he goes uphill. Yeah, so angina is okay. Yeah. Okay. Guys, let's give an example for what we have mentioned today. Quickly, I will give one station, I will pick one doctor, and I will only need history, 4-minute history. 4 minutes history. 4 minutes history, and that's it. An example. Okay. Dr. Sobhy, is he online or having iftar? Dr. Doris Grace. Okay, we need our BBC, our BBC News.
Oh
BBC
my
News.
gosh. Yeah, I'm here. I'm here.
How are you?
I'm scared now. I'm very scared.
Very scared?
Yeah.
Why? I don't think this approach of you. Okay, good afternoon, guys. Welcome. I'm really happy. I'm really glad to meet you here. I don't think you will be scared. Just be yourself. Be
Yeah, I
yourself.
think
You will do good.
yeah, no, I think when you're in the spot, Doc, it's a lot easier to comment on the sidelines, but when you're actually in the moment, it's a lot more difficult. But I will try my best.
No. Look, we are here. We are here now to give an easy example. Easy, simple example, just to apply. You understand me? Just to apply.
Okay.
A patient is coming with headache, and that's it. Apply the structure and move on. And we just gonna move on after we finish this. Just a headache. A patient is coming with headache. I just want to apply the structure,
I'll try my best.
and that's it. Yes. All right.
All right, yeah, go for it. Yeah, let's try.
Okay.
So are you going to be the patient? And I'll.
Yes, I'm the patient. Yes, just the history taking. Just
No
the
problem.
history taking, and please look at the paper in front of you. Look at the structure in front of you, and don't worry. Look at it, and just don't worry. Just
Yeah, no problem. I'll try my best.
And can anybody calculate the time when we start? Yes.
Wait, how many minutes do I have? 8 minutes?
No, 8 minutes. Only history taking.
Only history taking. Okay, so it's like 4 minutes.
You have 4 minutes.
Okay, yeah, yeah. Let's try our best. Okay. Do you want me to start now? Are you
Yes.
the patient? Are you ready? Okay.
I am ready.
All right.
I'm the patient. Yes.
Okay, no problem. Hi, how are you doing?
Hi,
Today, how
I'm
you
fine,
feeling?
doctor. I'm fine. Fine.
Right. By the way, what's your name? I didn't get your name.
My name is Mo Sobhy.
Oh, Mo Sobhy, how are you doing? Listen, I'm the doctor here today. I'm trying to kind of help you today. I hear that you've come in with a problem. Tell me
Yes,
exactly.
doctor. I'm just having some headaches, doctor. It's all
Really?
around
Okay.
my head. It's all around my head, doctor. Okay.
All around the head. Okay.
Nothing that makes it worse. Nothing that makes it better, really. It just I have it mainly before I go to work. Okay. And
Okay.
it goes whenever I leave my work. It just goes on its own. Okay. But I
Right.
have it every morning before work, and it just all around my head. It doesn't go anywhere else, doctor.
Okay, and tell me, do you have any other symptoms, like, for example, any relation to your eyes? Are they paining as well, or any neck aches, anything like that?
No relation to my eyes. No.
And no headaches? You're not, sorry, not headaches. Any fever? You have any fever?
No.
Okay, no worries, no worries. Okay, now, oh man, this is tough, man. I'm completely lost now. I'm like, okay, let me just think. Where do I go with this, man? Oh man, I need help. I'm lost. Honestly, it's so easy being on the sideline, but when you're actually in the situation, and I've got all these notes on my paper, and I'm like, what do I look at now? I'm like,
Don't worry.
Proceed
Look,
with
we're gonna choose
allergy
another
in
doctor.
history.
Don't worry.
Proceed with allergies and medical conditions.
No, we can't choose another doctor.
yeah, choose someone else. I'd like to kind of just sit this one out.
1 second, guys. 1 second,
someone else
because
will give you a try.
we're having a guy here who's selling things. Let's let him just go. Let's. Okay, Dr. Pink. That's a nice name, Pink. Dr. Pink.
Hello, doctor. I can.
Oh, is your name Pink?
No, my name is Dr. Pinky Roy.
Okay, where are you from?
I'm from Bangladesh.
Bangladesh. How are you?
I'm fine. How are you?
Yes, I'm fine. So, are you ready to do this 4 minutes history?
Yeah, I'm ready. Just a minute to connect my headphones. Just a minute.
Just
1 minute.
have a headache. A painful headache.
Hello.
Hi.
Hi, I'm Dr. Roy, one of the doctors working in this hospital. Can you please confirm your name and age, please?
I'm Mo Sobhy, doctor, and I'm 30 years old.
Okay, nice to meet you. How are you doing today?
Well, doctor, just I'm having headache, doctor. It's just like started about 4 months ago. It's all around my head, all over here, doctor. Okay,
Okay.
and just nothing that makes it worse, really. Nothing that makes it
Okay.
better. And I just have this headache, before I go to my house. Okay, I mean, I'm having some issues with my wife at the moment, and before I go to the house, I always have this kind of headache,
Okay.
and it goes whenever I'm outside my house.
All right. I see. You are really suffering a lot from this. I'm so sorry for this situation. Okay. So, anything else with your headaches? Have you tried anything to make it better? Any
No, no,
painkillers, anything?
no. I just
All right.
try my best to be outside the house as much as I can because just my wife causes me headache. She's just
Oh, I
annoying
see.
all the time.
Okay, all right. So have you talked to your wife about that?
No, just some issues, doctor, will never be solved. No.
Okay. I'm so sorry for this situation. All right. So has this happened to you before?
No, before this 4 or 5 months, no, everything was fine. No.
Okay. All right. So anything else with your headaches, like any fever or any pain in your
No,
eyes, any
no,
nausea, vomiting?
no.
All right. Okay. So how's your health in general? Do you have any medical condition?
No, doctor, no.
Okay. All right. So are you taking any medications?
No, doctor, no.
Okay. Any allergies to anything?
No allergy to anything, no.
Okay. So any medical condition that is related to like the headaches runs in your family?
No.
All right. So I'm so sorry to ask you, like, by any chance, do you smoke?
No.
Do you drink alcohol?
Not really.
All right. So do you have any fever?
Well, no, I don't have any fever even. I mean, I've never had fever for about like 2 years now.
Okay. You told me about the headaches, and that is related mostly to your home condition, and you feel better after when you go out of your home. Anything significant that you want to share with me? Important?
Not really. It's just like something embarrassing, some issues, embarrassing issues between me and my wife, but I cannot really discuss it now.
All right. So may I know what do you do for a living?
Well, I work as a teacher.
Okay. So are you under any sort of stress from your work or anywhere like that? You told me about the family life. Anything?
No, everything is okay in my work, and apart from my house, everything is fine.
Okay. All right. So is the pain going anywhere? You told me it's not going anywhere. Anywhere it's going?
No, it's not going anywhere. No.
All right. So okay. Can you tell me how long do the pain last?
Well, just like I mean, sometimes it's just like lasts for hours, but it's always whenever I leave my house, whenever I'm outside the house, it's fine.
Okay, I see. All right. So, well, is it be fine if I would examine your, check your vitals, that is the
Okay,
pulse and the temperature?
stop. How many minutes, guys?
344.
Sorry,
344.
Less than
3:44. Okay.
Yeah.
First of all, it is perfect history as far as I'm concerned, but She just wanted to add some things to the history. What are the things that she should add?
She missed the psychosocial history.
Mood.
Mood. Perfect.
How the headache is affecting your
How
daily
it's
routine.
affecting me.
Also,
Can
she
you write
missed
in the
about
chat
the
box?
slab.
Chat box. Mood. Main concern. Okay, perfect. Are you in pain now? Do you have the headache at the moment? Okay, perfect. What else?
Is that headache affecting your daily activities?
Perfect. Dr. Dania Khan. Dr. Dania Khan, she has raised my issue that I wanted to raise. Mood, main concern, psychosocial, perfect. Dr. Dania Khan, she has raised the issue that I wanted to raise. She said, guys, Dr. Mo has mentioned embarrassing situation. I said to her, there's an embarrassing situation. So she should have at least say, make me feel comfortable. Well, anybody comes through this door, they have some issues that needs to be addressed. Please feel free. There is nothing embarrassing at all. Things like this. For me to tell her the embarrassing situation. Why? Do you know why? Because the embarrassing situation is the risk factor. The embarrassing situation is that's why I'm having the headache. Are you lost? So it is the active listening part. Do you remember from last lecture active listening? Do you remember from last lecture active listening? When the patient is talking, listen carefully. Active listening is listen actively to what he's saying because you need to work on. Okay. Now, what is the cause of the headache? What is the
Stress.
cause of the headache? Stress. It is actually the problem between him and his wife, yes or no? So it is worth exploring. Are you lost? And I think I have stressed enough on the fact that this is the cause. Did you notice? But you're not gonna say, can you please tell me what is embarrassing? No. I'm really sorry that you feel that way. But please, feel free to talk about things here. Everything here is okay between me and you and the team. Please feel free. Anybody comes through this door, have an issue that needs to be addressed. Please don't feel embarrassed. Please don't feel alone. You understand me, guys? Not like, are you embarrassed? Yes, okay. No, he's embarrassed, but this is the reason why. This is the reason why he's having the problem. Am I clear?
We should try to, Dr. Mo, we should try to empathize with the patient and try to make him feel comfortable
Of
so that
course.
he shares on his own.
Of course. That's what I'm trying to say now. Of course. So now we will charge her 5 Egyptian pound. Okay? Bad listening skills. By the way, don't worry. Don't be alarmed. 5 Egyptian pound in sterling is like 10 pence. 10 pence. Okay? So active listening. Because it is the risk factor. It is the stress. Okay. Do you need to address this risk factor in management? Of course. Because, so my point is, plab 2 is like 2-bedroom flat. Plab 2 is like 2-bedroom flat. If you miss active listening, it will affect the risk factor. If you miss the risk factor, it will affect the management. So if you score low in management, it is because of many things. It's not only because of knowledge. Are you lost? It's not just because of knowledge. No. If you miss something in active listening, you will miss it in the risk factor. You will miss it. It will carry on with the management. It's just like 2-bedroom flat. It starts from the living room, and then you go to the rooms, but the living room is the history, is the other gathering. So active listening. Okay. But she was briefly recapping everything. She was asking everything quickly and nicely and everything. Okay. But you need to get used to the structure. Okay. Can I tell you one thing? And this is the last thing we're going to say today before the plan. I will tell you about the plan of studying, but let me say this first. If you say to the patient, how can I help you? And the patient started saying, I have headache, doctor, all over my head, doesn't go anywhere else, nothing that makes it worse, nothing that makes it better. Like how I did with her. Did she ask about the severity? Did she ask about the severity when you have the headache on a scale from 1 to 10? 1 is being the lowest severity, 10 is being the, did she ask about it? Do you know why she didn't ask about it? Because I distracted her. I distracted her by giving her many points of the Socrates. So whenever a patient gives you plenty of finding in the presenting complaint, what should you do? Recap it. Recap it. When you recap it, you remember it. When you recap it, you remember it. For example, Dr. Roy.
Yes, doctor.
Dr. Pink, I will ask you now about the headache. You have headache, and you say the same way. Give me some of the finding on Socrates, for example. Same way. I am the doctor. How can I help you? Then you give me.
Sorry, I didn't catch your point. What I have to do?
Now you are the patient, okay? And
okay.
I will ask you about your headache, and you give me some of the findings. Like say, I have headache, doctor. It goes there like this.
Okay. Okay.
Okay. So how can I help you?
Doctor, I'm having severe headache. Like it is in my one side. It's quite severe. I can't do anything with this. It's affecting my daily work. Please, doctor, help me out of this situation.
Oh, that sounds quite stressing, Dr. Pink. So, Dr. Pink, just to recap so I don't miss anything, you've mentioned to me that you have severe headache, and it's on one side of your head, and
Yeah.
you've mentioned that it's affecting your daily work. Am I right?
Yeah, doctor is right.
So can you please, on a scale from 1 to 10, 1 is being the lowest severity and 10 is being the most severe, can you please rate your pain for me?
Yeah, doctor, it could be 7 to 8. It's quite severe, doctor.
Oh, I'm sorry about that. Are you comfortable talking to me?
Yeah, doctor, I have taken 2 paracetamol. Now I'm feeling fine, but it's there.
All right. Please, at any time you feel uncomfortable, the pain is severe, that you cannot talk, let me know.
Okay.
All right. Can you please tell me and then carry on with the rest of Socrates? Did you get this, what I did now? Did you get what I did?
Doctor. Yeah.
Guys,
When I was just practicing, I was just tracing.
Guys, when you recap, you remember. You remember the stuff, and you start organizing your thoughts, and you start remembering what she missed.
Okay. Thank you, doctor.
Did you get it, guys? Did you get what I did?
Yes.
And you also involve the patient. Sorry, just to recap. And did you see when she said the pain is so severe? I said to her, are you comfortable talking to me? Are you comfortable enough talking to me? She said, yes, I am comfortable. Okay, at any time you feel uncomfortable, let me know. And when she said it's so severe, I was like, sympathy and empathy. It sounds so stressful. I'm sorry about that, Okay. Finally, I will just 5 minutes of your time. Only 5 minutes, and guys, one of the doctors opening his mic, I think. The mic. Okay. So, guys, that's how the course will go. That's how we'll go with the course. Okay. Now we are ready with the induction. Now the induction ready. Now we are ready with the induction. Now we are ready with the induction. What do you mean, Dr. Mo? Now we will start doing business. I will today give you 3 topics, and that's what we're gonna do with the course. So our course will go like this. I will give you, let's start with 2 topics. Let's make it 2. I will give you 2 topics. Okay? You will go. If you already watched A1 and A2, you will watch them first. If you have not, or if you have not watched A1 and 2, you will watch them first. If you did, you will start with the 2 topics. But if you did not watch A1 and A2, start with A1 and A2. So it's A1 first, A2, and then this lecture today, I recorded it and I will add it, but that's not the case every time. It's just today. I recorded it, I will add it. It's very important. It's a very important lecture. So I've recorded it and I added it. I will add it by tomorrow. So why didn't you tell us? Because if I did tell you, you're not gonna attend, but I want you to attend. Anyway, so A1, A2, this lecture, today's lecture. After these 3 lectures, you will start, write down tiredness and rheumatology. So what are the topics? Tiredness and rheumatology. But first, what should you finish? What should you finish first? What should you finish first? You should finish A1, A2, and this lecture. A1, A2, and this will be called A3. I will put it in the course as A3. So A1, A2, A3, then rheumatology and tiredness. Rheumatology and tiredness. Okay. The best way to study, listen carefully. Listen carefully. You will study rheumatology video. You will watch rheumatology video. Okay, and you will go to the notes, rheumatology notes, or you will watch tiredness video, and then you will read the tiredness notes. And after watching the video and the notes, you will make subgroups in the WhatsApp group that you are in. My course WhatsApp group. You will make group of 3 doctors or 4, no more than this. Then you will start doing patient doctor like me and you. Patient to doctor like me and you. Online. You will meet online and you will finish tiredness. Stations, the practice. 1 patient, 1 doctor, 2 listening, giving feedback. Move on. 1 patient, 1 doctor, 2 listening. 1 patient, 1 doctor, 2 feedback, you know? Then rheumatology video. Rheumatology notes by yourself. Practice with your colleague. Are you lost? Are you lost? So video, notes, practice. Video, notes, practice. And after that, we're gonna meet and do our own practice. Clear, guys? So today, can you please tell me what will you prepare for next week? For next week. It's not this Sunday, Sunday after, because today's session is instead of Sunday. Today's session is instead of the Sunday session. So not this Sunday, Sunday after. What are you gonna do? A1, A2, A3, which is that lecture. Then rheumatology, tiredness. How to prepare rheumatology? How to prepare rheumatology? Video, notes, practice. Video, notes, Dr. Mo, can we just study and that's it, and the practice after we finish the course? Can we study and the practice after we finish the course? No. No. Practice from day 1. How many doctors should be in a group? Maximum of 4. 1 doctor, 1 patient, and 2 feedback. And when, in order to finish quickly, do the station once, and then move on to the next station with your colleague. Okay, guys, it's iftar time nearly in Egypt now. So next Sunday, no, Sunday after.
I want to ask 1 question.
Yes, dear.
Yes, sir. Actually, when you say that we have to ask what's your main concern. So if the patient says, like in the same scenario of headache, the patient says this embarrassing problem, whatever. So what we will say that we will make the diagnosis and will address this concern at the end, or like what, where we have to fit this line.
The concern, you cannot address it at the start. If the patient wants a concern, it's always will be addressed in management, but you need to listen to the concern at the start. You get me?
Okay, so we will just nod the head after listening the concern, or we will say something.
Yeah, okay, that's the yes. I really appreciate your concern. Yes, it's a valid concern. We'll come to this shortly after, like this.
All right, all right. Thank you so much. And when we say that we will involve the seniors, so how to verbalize it?
Well, I will admit you in the hospital. I will talk to my senior because we need to give you 1, 2, 3. But don't worry, doctor. We'll practice. Don't worry. Today is not our. Don't worry. We'll practice tiredness management. Move on. How to say, how to manage. You understand? Don't worry. We'll practice.
Yes. All right,
Don't
all
worry.
right. Thank
Just
you so
if
much.
you follow A1, A2, A3, and the 2 session tiredness rheumatology, when we come, we'll practice them, and then you will know everything. Don't worry. Will be more and more clear.
All right. Thank you so much, Dr. Mo.
Guys, have a lovely day, and inshallah, see you someday.
Excuse me, Dr. Mo.
And please follow the lectures. Yes, doctor.
Excuse me, Dr. Mo. Yeah, today's top session that we had, that is A3, right? If I'm not wrong.
I will put it as A3. It's not there yet, but I have recorded it. I will put it as A3 in brackets time management.
Thank you so much, Dr. Mo. Enjoy your iftar.
Guys, have a lovely day, and inshallah, I'm going back to UK this Sunday, so it will be from UK the lectures from now on. And today's session was instead of Sunday, so we'll meet Sunday after. Yeah. Thank you very much. Thank you, Dr. Zaid. Thank you, guys. Have a lovely day. Thank you very much. Thank you.
Thank you, sir.